and welcome back to the Urology Care Podcast, the official podcast of the Urology Care Foundation. Our guest today is Ali Dabaja, a urologist at Henry Ford Health System in Detroit, Michigan. He is here to talk about home sperm testing. Listen along as Dr. Dabaja talks about what you should know when it comes to using home sperm testing for infertility. Dr. Dabaja, thank you so much for joining us on today's episode of the Urology Care Podcast.
Thank you so much for having me. This is exciting.
Can you first start by introducing yourself for our listeners?
Yes. So I'm Ali Dabaja. I am a urologist in the state of Michigan, in Detroit, Michigan, at Henry Ford Health System. I am the director of sexual medicine and infertility, as well as the vice chair of the Department of Urology at Henry Ford.
Great. Well, we're excited to have you on the podcast today, and we are here to talk about home sperm testing. So can you start by just giving a brief explanation about what that is exactly and what the benefits of it are?
So home sperm testing, it falls under the umbrella of direct-to-consumer home testing. And there are multiple platforms that are now available to male patients to use this. Now, there are home testing where you actually do the test at home yourself. There are some tests available where you actually mail out the sample and you get the results within a day or two. And those are the different kind of platforms that are available for the patients to where they are able to do the test at home.
So this seems to be a fairly new concept. So when did this really start to become most popular, and why would it be beneficial for someone to look into this option?
Yeah, so the technology kind of took off early 2000s. It was approved around 2012. Basically, it is for the purpose of convenience. Patients also might have some reservation of going to a clinic or to a lab to drop off a sample. It is, providing a semen sample is a little bit anxious, provoking to certain patients. And also there are certain patients that don't have easy access to an infertility specialist or to a lab. And therefore they might prefer easier format of testing, which is the home testing, like a semen testing at home.
Okay. And I can imagine that some patients may be a little hesitant to do a home sperm testing because of its accuracy. So how accurate are home sperm testing kits?
That's an amazing question. So basically, the home kits where the patient is actually doing the test at home, there are kind of three different kind of categories of those tests. There's the initial kind of generation of these tests started by looking at absent or present of sperm. So they only tell you if you have a sperm or absent of sperm in the semen sample. Later on, some of the tests have developed into providing concentration range or count range, basically how many sperm per the volume provided there are in the test. So now there are more advanced testing where you get a kit with where you can plug into your smartphone, and beside the count or the concentration range, you can actually learn more about the movement of the sperm.
Okay. And do patients have to go through their doctor to obtain one of these kits, or can these be received at a pharmacy? Where can someone go to get a home kit?
You can actually do this test without seeing a physician. Now, I don't recommend just having this test done without consulting with a provider. It's simply because although you are finding some information about the sperm count or the motility based on the test you're doing, there are other parameters within the semen analysis that does determine fertility that are not tested in these kits. And we do highly recommend that a patient who is worried about their fertility potential to seek counsel or to actually meet with a provider, especially a male infertility specialist, to talk about the test and get more accurate testing done and diagnose a problem if it does exist.
So kind of going off of that information, How should someone evaluate whether they would be a good candidate for a home sperm testing kit or whether they're better off seeing a fertility specialist or a doctor?
I think these tests can be used as like an entry point where a patient can, they don't meet the definition of infertility. Definition of infertility is trying to conceive for 1 year with no successes. And they're really worried about their fertility potential. So this test can kind of give them an idea about their fertility potential. In this setting, you can start kind of think about if you need to go see a doctor and get further testing done. Also, if a patient had previous history of vasectomy and they want to check and see if their vasectomy has worked, you can use that as a kind of crude test where it can tell you if the vasectomy has worked or not. Outside of that, I think a patient should seek out an infertility specialist to make sure that there's nothing else being missed and that you're not delaying treatment because time is of an essence when it comes to infertility.
Once a patient gets the results back from their home sperm testing kit, should they consult a doctor with those results, or would you only recommend that they follow up with a doctor when they get their results if it does point in the direction of infertility?
I always recommend my patients to share all information with me and be upfront and transparent, because the more information that the provider will have, the more likelihood they're going to be able to provide accurate advice to you. And so I think if you have done this test at home, you should share it with your doctor. And especially if you are concerned about your fertility and you're getting evaluated for infertility. So that's definitely a must. Now, the doctor may actually run further testing and extra evaluation, including some blood tests. And that's going to be part of completing the evaluation for infertility.
Okay. And so when is the best time in a man's life to use a home sperm testing kit? Is there a particular age or, a certain time frame after trying to conceive a child that they should use that? What advice do you have on that?
So I would say that if you're not trying to conceive and start a family, then there's no reason to be tested. If you are trying to conceive and start a family, then I would recommend patients who have been trying to conceive with their partner for 6 months to start thinking about getting a test. And maybe it's a good entry point to start with a home test and then follow up with your infertility doctor to further evaluate anything else that needs to be treated or diagnosed.
Okay, great. And what do you think is the most important for patients to know overall when it comes to home sperm testing?
So it is a crude test. It is kind of, a guesstimate of your fertility potential. And it is a good starting point. It should not be the final answer, and it's not going to give you the final diagnosis. I would recommend that if you're seeking out answers and if you have limited access, maybe this is a good starting point. And then follow up with your doctor to discuss the results and seek out further testing if needed.
Do you have anything else that you would like to comment on this topic for our listeners?
I think the home semen analysis testing or the home sperm test is a good kind of gender equity testing because, we have ovulation tests for female patients. And it's nice to see something along those lines for male patients. And so use it. And, it's available. You can order it online. If you have anxiety about your fertility potential and you're trying to conceive with your partner, order it and use it. So there's no reason not to.
Well, Dr. Dabaja, thank you so much for all of this incredible information and for joining us on today's podcast.
Thank you, Simone, for having me.
This podcast has been brought to you by the Urology Care Foundation, the official foundation of the American Urological Association. For more information on today's topic and for all things urology health, visit urologyhealth.org. That's urologyhealth.org.